Dieses Video präsentiert Ihnen Eumedix.
Have you ever wondered why healthcare professionals are asking you to rate your pain when you are in the hospital? Pain is mandatory to assess. It harms our body. During painful stimuli, our body's primitive response of emotional sweating in the palm of our hands or under our feet is activated as a result of the tissue injury. Whether a person is awake to feel the sensations of pain or whether a patient is sedated, for example during surgery, our body reacts to the tissue injury, so-called nociception response in sedated patients. It is important to manage the response from the tissue injury appropriately, so both underuse and overuse of painkillers will be managed to avoid side effects. MedStorm Innovation has developed a pain sensor through 20 years of medical research to assess pain and nociceptive responses by detecting skin conductance changes, assessing the nociceptive spinal reflex. The pain sensor assesses palmar or under the foot the response from tissue injury and the level of analgesia acting on the spinal cord, where increased amounts of painkillers inhibits the assessed response and too little painkillers increase the assessed response. These nociceptive responses are transmitted in the skin by acetylcholine acting on muscarinic receptors to stimulate sweat glands on the palms and under the feet. The process of firing in skin sympathetic nerves is found to directly correlate with changes in skin conductance, and these changes are detected with the pain sensor from MedStorm Innovation to tailor the need of analgesia. The pain sensor is wearable and wirelessly connects to a tablet or shows the indices directly on the patient monitors. It is also easy to use. Attach the electrodes to the sole of the foot or inside of the hand. The pain index is displayed for all age groups, sedated and not sedated patients, whereas the additional indices for awakening and nerve block are developed for patients going through surgery. The shaded areas of each of the graphs of the indices display the optimal area for patients to be in while receiving stimuli like tissue injury. Activity above the levels of the shaded area suggests the need for more analgesia, whereas activity below signals that the patient might have received too much analgesia. In this way, the algesimeter can easily tailor the need of analgesia for each patient in real time. Monitoring pain in this way is unique in terms of the reaction time of 1 to 2 seconds, while making it uninfluenced of hemodynamic and respiratory instability. By using the pain monitoring technology from MedStorm Innovation in the daily use of monitoring patients during anesthesia, intensive care, neonatal intensive care, and post-operatively, will reduce the many complications of over- and underuse of opioids, and in return it will improve patient safety and satisfaction, caregiver satisfaction, and the overall hospital economy.
Dieses Video präsentierte Ihnen Eumedix.